Yes, another day to be grateful for, and I know your week has been, one of amazing one, a splendid one, and I know you're enjoying your weekend as well. Today being a Saturday in October, we are still in the Breast Cancer Awareness Month. That's why, you see me today with a touch of flowers, some pink in there, thanks to Paris House of Fashion. In fact, and the one may look is so girlish and special, like a princess. Actually, that I am, the Akufi Princess Mercy B. And today again, we are going to talk about a topic about breast cancer, since we are in the month of October. And again, I promised you last week that Reverend is going to be back, and that she's here. And I also have another special guest. I'll introduce all of them, to you. But always remember that we'll bring you the beauty tips, and today as well we'll deliver. We'll bring you the beauty tips for today, and also get to learn a lot. We get to vibe right here on Girl Vibes on ETV Ghana. We are live on Facebook at ETV Ghana, and we're also live on HD Plus Decoder and Go TV Decoder as well. Quickly, let's go for a break. When we come back, we get to vibe, and I'll introduce my guest to you. Stick, we'll be back. Yes, we are back. Yes, we are going to invite today on Girl Vibes. Please call a friend if you haven't, because today's topic is very, very important. We are talking about the breast, since we are in the month of breast cancer. And today we are going to talk about assessing the impact of breast cancer awareness in young ladies. When it comes to young women, what are we doing in order to keep our breast in a healthy way and preventing it from breast cancer? And today, again, I have with me Reverend Marie, who happens to be a midwife and a life coach as well. And she's also my best friend. So, she's been coaching me on the side and everything, and taking good care of me. Hello, Rev.
You look good.
Debiana Hofena Jai 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 Shada. Debiana one Hofena, it's on another level. And then so them
Thank
and there's
you.
the Ashada Blacky Bika crown and the African look on the braid side. And some on why for
Me
that's
that's
a
it.
daddy be a pretty looking youthful and young. Yata on your shade. Aquaba.
Yeah.
Last week, go on Ghana, Miss Mon. I believe that Sha says you won't quite
Oh,
with you.
I'm a major fan spa.
Thank you. And that's you, yeah, best and I'm of you. Sorry, Aquaba.
Yeah.
Matthew. Matthew, baby. I think the last time we met was, I think, earlier this year. And I was
Yes.
last year, Mom.
No, earlier this
Earlier
year.
this year. Oh,
Yes.
Matthew, Toto. Hey, how Aisha? How's Aisha?
Aisha is
She's
doing
good, eh?
well.
Oh,
Yes.
thank
She
God.
sent her regards.
Okay. I miss you too, Aisha. Please do come by, okay, one of those days. So, Farida is also a trained nurse, and so today we are going to talk about breast cancer. Yeah, can breast cancer cry? Yeah, but say, I bet no be what's when your breast cancer. Say, baby, who not need to who create to do. It comes with a lot, so that's why we've made it necessary to talk about it today. And it's been in the month of October. I'm actually on Girl Vibes. The whole of this month, we are going to talk about breast, because it is. Let me not say the most important, but I feel it is very important when it comes to the life of every young lady, because enough no all my head in yam at I say what for and your breast cancer and so or misma a yan zamano akwakoye in being the phone so what you mean your breast cancer ni be in your or baby and to say when you're being to be so obey a true phone na friend I'm an tuning in and so Aisha Girl Vibes on ETV Ghana and Rev wa basic or your midwife in see men for no chassis, because last week on that yan in the chassis were how to even the size of the bra and all those things, and celebrating the no bra day. But today we are talking about breast cancer itself. Rev, akwa babiem. And then no, we are talking about the breast cancer itself. Now, I na yaka breast cancer crowd. We become breast cancer. Now, so we hear of cancer and we get so scared. First of all, should I be worried when I hear of it? I na yet sipa. The yebushi ni bi anado bi engebia. Should we be worried?
Um, First of all, I want to send best regards to um, the viewers of Girl Vibes.
All right, go ahead.
Yes, breast cancer is a type of cancer that happens in the breast. It's a malignant tumor,
Okay.
and so it has a lot of stages before it gets to um, the cancer.
Okay.
So I think the first stage is a bit mild, and when it is seen, treatment is done.
Okay.
But from the second stage to the last stage, that is the fourth stage, when nothing is done, there's going to be a problem. And if you hear breast cancer, you should be worried, but not too worried,
Okay.
because ɛtwe w'adwene si so sɛ ɛwɔ sɛ wokɔ hospital na wokɔ check sɛ biribi saa bɛtumi awɔ hɔnom a, and there are a whole lot of causes and risk factors if you fall under it wotumi yɛ prone to getting breast cancer. Yeah.
Okay, our case one na me fanko Farida ho. Farida on breast cancer na kasa no pono. I will breaking it down from my fancy from me. No fancy should I get, but try it for me today. Today I just want to try. Say you can breast cancer or be on table for or be on TV or to cancer. I mean we all know yet to cancer na or miss man somebody or be damage about some never catching in a simple way or better than who I say in order to be careful and I say but own sure be or be sure not in way to know.
So breast cancer is, like I say, cancer affects the breast. No? So cancer can affect different parts of the body, but when it affects the breast, that's
so
what,
that's
what it same as breast cancer.
And the cancer always do food.
Yes, that's what we term. And when this happens, the cells in the breast they grow abnormally. Once your body, the cells are programmed in a way say, as na cells break it down, the new ones are formed, so that it continues. It's like a cycle. But in cancer, the cells grow more than they should abnormally, and then it may affect the other organs in the body.
Oh, okay. Yes. Now, breast cancer, Rev, how does it not cause the breast cancer? What usually causes it?
Okay, so enyama bebre cause breast cancer. Research amaya who said there's no clear cut idea a cause breast cancer, but your risk factors be falling under like we are prone to getting the cancer.
Okay.
Ebi ne saying family history. Say ebia o maame ana say o grandmother ana say unua ana o baby at a younger age unya breast cancer. Also say wan hwe hu ya unso timi enya bi. Afin so no say onom nsan bebre a utimi nya breast cancer because to say the Farida cells no hyperplasia abnormally.
Okay.
Enunti say onom alcohol bebre a fasting action no. Yes. Afin so no say unya omenaki ntema. Menaki o first menstruation. Obi wo honoma unya the first menstruation before 12 years. And also you're prone to breast cancer.
This is your problem.
Yes. A risk factor. Obi nso ewo honoma or when the first born after 30. And also you're prone to breast cancer. After so obi wo honoma it take a very long time and sana wanyem. To say be 40 years. 40 years ni na onyem oda. Or you're prone to getting breast cancer.
And why is it so? Because I gave it a bobo, and that's suddenly because I've not given birth before, or because I menstruated at an early age. I get prone to breast cancer.
Okay, so the anatomy and physiology of the breast nankasa say, say it drew the body makeup no, it drew stage bia, or productive age no. It drew honum na say when intimi and produce baby my breast no anya responsible and anya active na say breast na relax for a very long time. Yes. And sometimes and so no say unya menses enter to say bia unya menses at age 9. Until from age 9 to me fan say 25 years no wako school santi I bear a very long time my breast no anka unse unya o menses the breast has to be active.
Okay.
But unya from time unya o menses na till maybe age 25 no.
Yeah. There's been no breast milk out of the breast.
There's been no breast milk, there's been no pregnancy and all those things.
Okay.
Inti abnormalities etimi set in. Omonso so omunya menopause at an older age. Unse menopause is between 40 and 50 years. But obi ohonoma 60 and 65 na fe no nya menopause. Ononso or you at risk of getting breast cancer. Yeah.
At the age of 60.
Yes. Obi so ohonoma ni genes no yewo genetic malformations.
Okay.
BRCA1 any BRCA2 mutation no say a mutie and I say problems about formation and also we are prone to getting breast cancer genetically. Yeah.
Okay. Fari, on this note, how does breast cancer start?
Okay. So there are various ways that breast cancer is the stages of breast cancer is described. But one of the most common types is the TNM system.
Okay.
So the T stands for the tumor, the size of the tumor. The N is the nodes, which is we also call the lymphatic nodes. They are part of the lymphatic system in the body, and they are closely associated with the blood vessels. They aid with regulation of fluid in the body, and they are found. Some are found very close the clavicle and under the arm. That's what gives it close proximity to the breast.
Okay.
So, and then the M stands for metastasis. That's the spreading of the cancer. So we have 5 stages. So the stage 0. This is when the tumor, that's the cancer, the tumor is found in the ducts of the breast. So it hasn't spread. There's the 0 stage. That's why we call it the stage 0. It's found in situ. And then the stage 2, the tumor is about 2 centimeters and it hasn't affected any lymph nodes. Then we have stage 2. That is also when the tumor is about 2 centimeters but not more than 4 and it hasn't spread to any lymph nodes. Then the stage 3, that's when the tumor is about 5 centimeters or more and has affected about 2 to 3 lymph nodes. Then the stage 4, that's the final stage. It starts spreading when it's not controlled. It starts spreading to other parts of the body.
So at what stage can it be let me ask, can it be cured totally?
I can say yes, it can be stopped or removed when it's in the stage 0.
Okay.
You can take it. That's when you say there's a tumor in the breast, and then you can take it out since it hasn't spread.
Okay.
So they perform a procedure known as lumpectomy. So you take out the tumor, and then they also take some of the surrounding tissues of the breast to prevent it from spreading.
Okay.
So when this is taken out, we can say that it has cured or the person doesn't have breast
Through
cancer.
surgery?
Through surgery.
Okay.
Yes. But when it gets to maybe the 3rd or the 4th stage, it has started spreading.
Okay.
So right now we can't say we've cured it. So there will be different modes of treatment which will be used to cure the cancer.
Okay.
So at that stage we can't say we've cured the breast cancer since it's spreading. It can get to other organs of the body.
Okay.
Yes.
So at what stage na obande wocha obande nufunifio?
When it has metastasized,
Okay.
it has spread to all
That is the
tissues of the breast, and then it has started spreading to other organs. That is when we have to take out
the breast and put in the fibers.
Sometimes everything is taken out to prevent it from reoccurring. You know, breast cancer has a chance of when some of the risk factors. When you have a history of breast cancer, you have a higher risk of developing breast in the other breast as well.
Okay.
So most of the times, the entire breast tissues and even the lymph nodes are removed because it has spread to the lymphatic system. Yes. So to prevent it from reoccurring, you'd have to take everything out.
Everything out, loosen your breast.
Total mastectomy. We call it total mastectomy. Yes. So the person will lose breast. And in most cases, some doctors will advise that since it has spread to other tissues, you should also take out the tissues of the other breast. Some people opt
So
for
you
that.
get to lose both
Breast, because there's a higher chance of it spreading to the other breast. Yes.
Okay. Rev, let me come to you again. Talking about instances where somebody can, you made mention of the family being a chain of which somebody should be worried if you found out somebody in the family has gotten breast cancer before. Now, in this stage, if I'm in this stage of knowing that a family has been infected with breast cancer, another breast cancer, what are the things that I can do to prevent myself from getting it, from it developing in my breast, or even getting to the 0 stage or whatever stages that it had to go?
Okay, so regular checkup is very, very important.
Okay.
So that when you finally get to know that there's a lump in the breast, something can be done about it.
Okay.
And then self-breast examination.
Yes, let me not catch you. Today we have a video that shows how to examine yourself at home, as a woman, as a young lady, how to examine your breast yourself, even before going to the hospital. The regular one. I don't know how often we should be checking, but we will get to know. I just had to cut you in to prompt them that we have a video. And Rev is here as well. It's in the video, no sorry, church mama hand. Farida is also here, so we'll be doing the talking and everything with you today. So make sure they all be Shaggy Vibes in Dampacho to phone na friend. Now on Facebook also we are there at ETV Ghana. Ekohwane to my like next year. Na exam me or comment be so able to be Janet is that what any question that you want to ask, because this week is breast cancer awareness month. Actually this month I mean it's the whole of this month, we are going to talk about breast cancer, and more requests that was at my hand and there, so yes, I'm very, and most people are asking about the examine of the breast. So we have the video and we'll show it to you. So we'll be back after this short break. When we come back. Okay, so welcome back. Let's talk about the breast examination. I told you we have a video that we want to teach you how to do the self-examination anytime, anywhere. You need to know how to examine yourself in order to prevent breast cancer. So let's watch this video.
Nipples, wedges. Starting at the outer edge of the breast, move your fingers towards the nipple and back to the edge. Check your entire breast, covering one wedge-shaped area at a time. You should not lift your fingers while feeling the breast to make sure no area is missed. Whatever method you choose, make sure to cover the entire area.
Okay, so welcome back. So that's the video. Who makes my be more immersion? I don't get easy because I mean the way she's pressing the breasts. I know how to do the self-examination, but this one I think she was pressing more, deeper and more harder. Rev.
Yes, so we have types of self-breast examination.
Okay.
This is one type, and then we have another type where you put your hand, like let's say we are examining the left breast, and then you put your hand at the back of your head, in front of a mirror, with your oil applied, or shea butter applied, and then you divide your breast into 4, an imaginary line of 4, and you make sure that each of the space you massage, each of the space you massage. But the most important thing is that the breast starts from under our arm. That's the armpit, the axillary tail of Spence. Axillary tail of Spence is there. So if you don't massage getting to your armpit,
from the armpit side,
yes, you might miss a lump over there. Sometimes the lump doesn't necessarily have to reside in
nipple
here.
side or inside of
In
it?
here,
Okay.
it goes under
Or to
under
push
your
my whole
arm.
crowd.
Yes. So
I think
if
that
you
one
don't,
would be more dangerous if you don't check it, if you
sure,
don't examine
sure,
properly.
sure.
Because most
Sure.
today a checker, we do it this way
Yes.
instead of checking from
So
the
I always advise that we use the imaginary line of 4
Okay.
to do the examination so that we can concentrate on the armpit.
Okay.
Then you come here, and then afterwards you can just try to squeeze the breast like you are holding onto the areola,
Thank you.
and you see if something will come out of
Of
it.
the breast.
Yes, sometimes it's clear, sometimes it's milky, sometimes it's cloudy, sometimes it's bloody. So, say a bloody and a milky, a bra breastfeed, you need to go to the hospital.
Okay.
And as you massage and so no, if there's pain, you need to go to the hospital.
Okay.
If there's lump, you need to go to the hospital.
Okay.
Sometimes the breast start to change in shape,
Okay.
and even the nipples. The nipple is not supposed to be inverted, but here's the case that it has started going in.
Okay.
It is retracting. That one too, you need to go to the hospital. Is an abnormality. So anytime you see a change in the anatomy of the breast, you should go to the hospital.
Okay, so if you see the nipple going in,
Yes, it's not supposed to go in.
it's not normal.
Yes, it's not normal. So you have to go
And
to the
check.
hospital for further check and management.
Okay.
Yeah.
Okay. Okay. And what if you feel some kind of heat around the nipple area?
Yes.
The dark.
Yes. Anytime you feel heat around the areola, it means the breast wants to become tender. In this case, you are not pregnant or
Okay.
you are not breastfeeding. So when you feel heat, it means that tenderness is starting. You need to go to the hospital.
And
sometimes there are dimples on the breast.
Okay.
There are dimples. When you see that your breast is beginning to have dimples, or when you press it, it pits.
Okay.
It pits like into it.
Yeah, to kurba.
A toma.
Okay.
You have to also go to the hospital for checkup. It could be a sign of
Breast
a
cancer.
breast condition. Yes,
Okay.
not necessarily cancer, but it could be a sign that something is happening.
wrong in there.
Yes, cancer can only be diagnosed by the doctor at the hospital. So
Okay.
when you are doing your self-breast examination and you see all these abnormalities, you don't diagnose yourself
Okay.
unless you go for further management. And
Farid,
treatment.
in doing this breast examination, what are we actually searching for in the breast? What do we find in the breast that makes us worried? Is it a sensational feeling, or is it the lump, or is it just the milk that comes out of the breast that makes it to feel worried that we have something going on?
Okay, so we are looking for anything abnormal.
Okay.
That is anything out of the blue, which is not normal. So first, before you do your breast examination, you are supposed to look at the breast.
Okay.
So let's say you are using, if someone is doing it for you, the person would check first before starting. But if you are doing it yourself and you are standing in front of a mirror, you have to check. Normally, one breast is bigger than the other in every female. It's just slightly. You find out that one breast is slightly bigger than the other, which is very normal. So you check for the appearance, the size, and then when you are palpating, you check for lumps.
Yes. That's what I
So
want
that
to
is,
hear.
yes, you check when you are palpating, you check for the lumps. So that's why you don't lift your finger and then you continue, you put it somewhere and then you start palpating again. So as far as your hands, the pad of your fingers is placed on it, you have to continue in
Until
that
you're done.
circular motion.
Okay.
So we are looking for lumps,
Okay.
and then we also check the areola. We check for dimpling. When there's dimpling of the skin of the breast, then there's a problem.
Okay.
You squeeze the nipple to check for any discharge.
Okay.
As she said, it should only be when you are breastfeeding.
Okay.
That
What
you
about
should
when you're
have.
menstruating?
When you are menstruating, before menstruation, ovulation, when you are ovulating, there are some changes in your body, like your breast become a bit swollen, and sometimes it's hard to touch. And some people will even tell you they have clear discharge from the nipples, which some people will say is very normal. But just in case, just to be on a safer side, you can also visit the hospital and check if everything is okay. So as far as you are not breastfeeding or you are not a lactating mother, you shouldn't have discharge from the breast at all.
It's not normal.
It's not normal.
But there are some ladies that get this breast milk anytime that they are menstruating.
Well, it could be a disorder, because it's only when you give birth that the hormone prolactin is released for the breast to start producing milk. I don't know about them, but if they could go to the hospital and check, it's only when you are breastfeeding that you're supposed to have milk. But it could be a disorder they have, that anytime they are menstruating, they get breast milk coming out of their breast. And then you check the skin of the breast. The skin of the breast should be soft, it shouldn't be hard. So when it's hardened, you know there's a problem. Or when it starts flaking or peeling or crusting, you also know there's a problem. Then you also have change in the color of the skin. It's also, and then we have reddening and swelling. Also shows there's a problem. Or when the skin of the breast becomes like the orange. You see the way the skin of the orange is.
So those are some of the symptoms?
Yes, some of the signs and symptoms that could lead to. Not necessarily, but they show that there's a problem with the breast.
With the breast.
Yes.
When it comes to that.
Yes.
So aside all these signs, there are some symptoms that the person can also feel, like nausea, vomiting, excessive tiredness. Just say, "Utimi Brahma, obeda, sorry, all right, resti, all right," but still no, you feel tired. So aside the signs that you are seeing, these are some of the symptoms that you can also feel that you need to go to the hospital for a checkup. Some people have abnormally hormonal imbalance. Some people who have this condition tend to have milk coming out of their breast when they are menstruating. And these people should not, I repeat, should not absent themselves from the hospital. Yes. You shouldn't absent yourself from seeing your doctor or your specialist because you have hormonal imbalance, so anything can happen. You are menstruating and there's breast milk flowing already. It's not normal, so you should. So I always advise that for you to really get to differentiate the pain of breast cancer in the breast, or let me say it this way, for you to differentiate the pain associated with breast cancer and the pain associated with menstruation, you always have to do self-breast examination after menstruation. After menstruation, where the hormonal levels have dropped and the breast is at ease now, then you can do your self-breast examination, so that when you locate a pain, then you can say that I'm not ovulating, I'm not menstruating, and there's pain. So when you go to the hospital and then you tell your doctor, something can be done.
That's it. Now, you try and come watch no, and if you're hired, papa, and you're baby. And I know this one, most of the men, but breast cancer, what's the breast cancer, so yeah, or your man one is a won't, but no. Since you also have breast, last week you saw if you had a it is also breast. So talking about the breast cancer and the discussion is to be fat most of all. But now Farida Erica there nipple nukudoma. So you have to be worried or see a doctor. And being photos also to bandama.
Men can also get breast cancer, but it's just that it's not common. Because 99% of breast cancer cases are found in women. But we can't ignore the 1% as well. So it's just that their breast is not as heavily endowed as the women. You know, we have connective and glandular tissues in the breast.
Yeah.
But the difference between the male and female is they don't have these tissues, a lot of these tissues present in the breast. So they can also experience these things.
Okay.
So when the nipple is retracting, or there could be a newly inverted nipple, there could be another nipple created, then you know there's a problem.
Okay.
So this could also happen in men. Yes.
So what should be the first step to take when I notice there's a lump in my breast or there's a pain in my breast? Is it just to run to the doctor, or in case there's a sharp pain, at night? Can I personally, there are some when they start to feel pain, they go buy those balms and, ointment to rub on the breast. Is it advisable to do that?
Immediately you find out there's a lump in the breast, the first thing you should do is to report to the hospital.
Okay.
Let's say you could have a pain which goes and comes. It could be a signal that you are reaching. Because breast cancer, it takes a long time before the lump is noticed in the breast. So it could be that during that process you felt pain, or you ignored it, or you went to buy pain medication and it's gone. So you've just decided to forget about it. Immediately you feel these symptoms, please go to the hospital. If it's not detected through the breast examination, they could do a scan for you, and then they could detect these things easier than the self-examination. So the first thing is to report to the hospital. Don't sit at home and say you are praying and all these things, or take it somewhere and go and apply all these concoctions. By the time you reach the hospital, it has reached the final stage and there's nothing that can be done than to cut the entire breast off. So that's why we encourage early detection, and then you report to the hospital so that these things can be treated earlier to prevent further complications.
Okay. Rev, is surgery the only solution?
I would say yes. And the reason why I would say yes is when a lump is felt or seen, it's supposed to be removed. Because it causes pain, it causes discomfort, and it can be cancerous as well. So to prevent it like going further to be a cancer, it must be removed. I've heard some people say that when you take herbal medication, it melts. Lumps do not melt. Lumps, they do not melt. It is taken out by surgery. So if you are watching us, don't let anyone deceive you. When you see a lump, just go to the hospital for treatment. And this kind of surgery is not something deadly. It's not deadly. So when you go through counseling and all that before the surgery is done. It is better to get it removed than to wait for it to be cancerous and then the breast will be removed actually.
Thank you, Rev. On that note, let's go for a break. When we come back, we get to talk about ways to prevent breast cancer, because when we send will go through the surgery way. So let's go for a break. When we come back, we get to talk about ways to prevent breast cancer. We'll be back. Okay, so welcome back. Thanks to Adonko Next Level Premium Energy Drink. Who want a debia or bohen by the beauty tips? Yes, the small kama. Now, Adonko Next Level Premium Energy Drink, no, all my vitality, all my huazin, all my pomazin. In fact, say area juma or bomb menya huazin shrunko is the ye juma. A banker, a presenter to the bankers. It may be a beer, a huazin juma, that's a brand patch to Adonko Next Level Premium Energy Drink. I'm a packaging in Crano. kubo no se can kama tuntum na was a gold level bo natural wa don't next level premium energy drink no wo ho epedodo na etu na atono so a from one was 020489869 and a 0592610 I don't next level premium energy drink, no limit. And there combat echo and chrome maybe a being I don't next level premium energy drink nibi. Na ato me that say now and then we are talking about breast cancer before the break now miss yeba yebeka about how to prevent breast cancer and what I said to them is you sister do come omo one was in oma confidence to walk around but suddenly otumoba through ebusuam bɛtumi anya ndzɛmba bebree wɔ hɔ a yɛbɛtumi anya breast cancer and then Rev Maria wɔ ha and Farida nso yɛ nurse ne nso wɔ fie ha and we are talking about it yɛhu ndzɛmba bebree a ɔtum ma yɛ breast cancer but what I also want us to know now is how to prevent it. Rev, aba ndzɛmba na yɛyɛ a ɔbɛtumi prevent breast cancer.
Okay, so breast cancer can't be prevented.
Wow.
Yes, but the risk factors is what we have to manage.
Okay.
So if you have a personal history or a family history,
Okay.
then you have to manage it by the regular checkups that I mentioned.
Okay.
Yes. And sometimes you find people also bleaching and they bleach the breast. So it could cause issues for the breast, and so I will advise that bleaching should be stopped. And then you should know your bra size as well. You should know what to wear when it comes to bra. People have bigger breasts and then they wear small bras, and they tend to constrict the breast so much to the extent that if it affects their backbone and all that. So you have to put a stop to that as well. But the risk factors should be managed.
Okay.
It should be managed. If you have hormonal imbalance, you should see your doctor for management.
Okay.
Yeah.
Okay. Fari, is there any you would like to add up in terms of preventing it? Since Mary says it can be prevented, what can we do?
That is unknown.
Okay.
And then the risk factors is like a study that has shown that these people, this particular group of people have had breast cancer cases more than the average person.
Okay.
So something like alcohol intake, you have to reduce or avoid alcohol as much as you can. Obesity is also a risk factor.
Okay.
So when you are obese, you should try and manage your weight and then do physical exercise as well. Also, one of the risk factors is that women who have a child after the age of 30. So if you can...
After the age of
30. Yes. So if you can...
then I'm at risk.
It doesn't necessarily mean you would get it. Because some people don't have these risk factors and they still get breast cancer. So when it's manageable, then you can maybe get married early and have a child before age 30.
Okay.
Also, women who have not given birth before are also prone to risk factors. And with that, you can't really control fertility. Also, being a woman is a risk, and you can't really control that. So you just control your diet, your lifestyle, avoid smoking and alcohol, and then eat well, exercise, and I think these things. And early detection as well. You do your screening, you go for breast screening. If you have a history of breast cancer, you go to a genetic counselor and you have these tests so that it will detect if you have the mutated gene or not. So this can help you to manage it early before it spread. The goal is to catch it early before it reaches the final stage.
Is there any food that we can eat in terms of managing all the? I mean, are there any fruits or vegetables or any foods actually that we can eat to help our body?
Okay, so there are no specific foods or meals that prevents breast cancer. But a balanced diet will help. And then fruits and vegetables will also help. And then taking in more water will also help.
Equally help.
Yes, because as your immune system is built, cancer is reduced because it is very strong to fight any disease or infection. So once you build your immune system by taking a balanced diet, eating more fruits and vegetables, and hydrating more, I think you are good to go. Yeah.
Farida, I wonder when your breast cancer data. Is there any advice that you have to tell them? Is there any education that you would love to give them?
Those who already have breast cancer.
Those who already have.
I think mostly in our Ghanaian societies, they don't like to come out about these conditions.
Yes.
When you have a breast cancer, so those kind of things. So I would really appreciate if they come out to educate the youth about breast cancer and what they went through, how they were able to manage and cope, so that anyone who gets the disease will also tell themselves that if this person could do it, I could also do it. So we would really encourage that they share their stories and not keep it to themselves. And not take it somewhere for prayers or something. Go to the hospital. In as much as you pray, go to the hospital. Then you go to your prayer center as well, so they can help you spiritually. And then your family also supports you, so that you would tell others that it's not a death sentence. It's something that can be managed. And then you encourage more people, especially young girls that are upcoming, to also know about the disease and what to expect. And as women, as she already said, wearing the correct bra size, eat healthy, manage, take in a lot of water, your fruits and vegetables, a balanced diet, and have an exercise routine or something, at least if it's once or twice a week, so that you keep your weight in check, and then take advantage of these screenings, especially in the month of October. There are a lot of screenings that are organized for free, so you can take advantage and go and screen. Yes, and know more about the disease.
Or maybe do the self-examination that we talked
every
today.
month after you are done with your menses. Then you do it yourself. So we are able to catch these things early before they cause a whole lot of problems too.
Yes.
Yes.
That's if I read. You're sure. I say, but na me jaokwa. Me watches it from Onga. Me zebemau. Na me producer pacho. Shase na fa Onga no fabra. Na me fama Farida na Rev ha. Na Rev, before we call cry, I know before coming on set we were talking about a way to exercise the breast and think up quickly. No, before we wrap up. No, it would to in an easy way help us to.
Okay, so you can exercise your breast by say stretchy uchi say obase obokakra na wachi say kakran kakra. So you can even do this just before you do your self
because of exercise need to watch it in 3 minutes into your exercise not featuring, because it's a very important thing to know. And I'm in a Farida na baby
bring your breast out. Na yentry you left kakra right kakra. Yanko kakra. Yes, slowly. Into a boy.
Okay.
A boy ma circulation a year active. A boy ma ye relieved. Okay. So let's stop the exercise. How do you feel? You feel so relieved. So even before your self-breast examination, you can do
it in
this exercise. Yes.
Is it just any time that you can do the breast examination or the exercise? Is it just let's say for instance morning, afternoon or evening, or you can just do it at any time?
Okay, so whenever you feel comfortable, you do it.
Whenever you feel comfortable
Yes,
to exercise, you can do it.
Yeah.
Okay. Okay, so anytime at all you can do the
Anytime
breast
at all.
exercise.
That
In
you
fact,
feel
exercising
comfortable.
cry, it's an easy way. So I think even at work, cry, you know, an easy way.
There,
And they call
there
left to
are
cry.
even some dance moves that include this. So
Uh-huh.
you
Yes,
can
it's
even be
true.
playing music and
Music
be
and
doing this.
between
Yes,
it
it's
and
a
then
form of
ah.
exercise.
Okay. It was why just started off into your function. On that note, and Marban is a rev. You ain't chow cry. I say, I mean, sure. Every Saturday piano, and you're very my hand. Nah, ever my education as a reverend. She's a reverend and she's a life coach. At the same time, she's a midwife. Oh, you my baby. And me make up at the Cindy. Name what general papa papa. Because all but fear counseling knows him a Cindy. On easy, but I'm the Cindy in front of kaka. They be a Cindy no more making me come on. They ain't many uncles. But say your home margin on your street. And also to Paris House of Fashion. One a debut with them for setter. And the matter I may say, one na one mom, you know, atare kama. Ah, Miss Abba Betsy. And then, in fact, Master Kufi Princess Ankasa. And there's a Master Princess. And see, let me give you the contact of Paris House of Fashion so that anytime, being it your wedding, any party, or whatever the occasion is, Efra, Paris House of Fashion, Wabejo Odo, kama. Now we should shout what her needs to do. Not was I'm going to call her on 054 309 1892 054 309 1892 a Fred Paris House of Fashion na catch on day and show girl vibes it could be princess next style launch and then pepe may suppose to be snake me come and today I also have a gift from Onga. Last week, Mama Mausi na Rev B, and then so you best now one at Chelsea Beam na was a coffee from Onga. Onga no Rev is what I said. There's an Aussie in corner for you. Very, and then me Onga package come Miss Moa. I was in this way
For cooking.
for cooking. I know for cooking, but you know what food exactly there? No, I usually use the Onga seasoning.
Mostly jollof. And
Jollof,
stews.
Ghana jollof.
Yes, Ghana.
Ghana. Okay, it's me too fat gift no more on this year. Na today I wrap up for the day. Onga na kama damp pepper na all packaging. Onga seasoning na onga seasoning chicken zini bi wo mezebe unkontomre no no your favorite. So Rap, this is for you from Onga. Want to say thank you for coming. Tease it. It
was very nice.
Oh wow, yeah, you're not. Oh, nice. And Farida, please, you can equally, do some yo kakra, stew kakra. That is a good. We say thank you for coming on Girl Vibes. On that note, we also want to thank you at home for watching Girl Vibes today. And we know every Saturday at 6 p.m. no, Ayanes TV is at ETV Ghana to watch Girl Vibes. And the whole of this month is Breast Cancer Awareness Month in Timepacho. This month to make it, a time every 6 p.m. to tune into ETV Ghana. And we stream live every time on Facebook at ETV Ghana. I like that. Share as a comment to be as at home. Meda I don't connect level premium energy drinking fast and leave tomato mix me pacho. Eko goda way to appetite. And the area for area won't quanibia. Pacho na to leap tomato mix no na easy be aye. It was supermarket, it was shop na e pede it will leap tomato mix nibi na eto na Mr. Frahon on 050 140 1085 and at 033 209 5314 and they better leap tomato mix ne hon komona and the menu to share Kofi Princess Medasi Bebre. Thanks to my team, my director Johnny John, my producer Rashida, assisted by Regina, and to the entire crew. Obey it was BBI fine at say. And thank you too for watching. My name is Mercy B, the Kofi Princess. Nyamen Kao.